Dr. Davidson, welcome to the program. It's great having you with us. I'm curious if you watched Bob Kennedy's. I refuse to call him Robert or RFK. That was his father's name, and his father was a hero of mine. But anyhow, if you saw Bob Kennedy's interrogation this morning in front of the Senate.
Working on our own podcast as well, but then also got clips from our team. But yeah, watched certainly enough of it, and I'll try to digest more of it later on this afternoon. Interesting show.
I'm wondering your take on, having as the nation's chief public health official a guy who has absolutely no medical training. He's a lawyer.
Yeah, I mean, listen, it's not only not having medical training, right? Presidents go in with so many different issues they have to deal with, and none of them are experts, but they get people around them who you can trust. This guy had that at the CDC, right, at FDA, at the Advisory Council for Immunization Practices, all of these different entities that have existed in our public health apparatus, and he's summarily gotten rid of people. People have to take loyalty tests to him and to Trump to be there. So that's far scarier than someone, without that background or history. But he showed it off today how he really doesn't understand basic principles of public health. Dr./Senator Cassidy, in his questioning, very much, said that. I think he tried to pull him in. If you saw that part where he asked him if he thought Trump deserved a Nobel Prize for Operation Warp Speed. I don't know about the Nobel Prize, but certainly Operation Warp Speed that got us the vaccine in such a record amount of time and truly saved millions of lives is something they should all be touting. It should have been on hats and billboards and signs for the 2020 election, but Trump has run away from it. RFK or Bobby has said, he thinks the vaccine killed more people than COVID killed. And then in the next breath agreed with Cassidy on it was a great achievement. So he's just showing his complete ignorance and his fealty to his anti-vax roots that got him in this position in the first place.
Yeah, which is deeply unfortunate. I tried to schedule a COVID shot. It's been a little more than 6 months for me, and I'm over 65. With local CVS here. And a couple hours after I scheduled it, I got an email saying we're not offering COVID right now. The COVID vaccine is unavailable at the CVS. What's going on with this?
Yeah, the FDA just updated its guidance, right? And they ended the emergency use authorization that had been in place from the beginning of the vaccine, and then they kind of re-upped, citing that only people over 65 or people with certain health conditions were able to get the shot. A lot of pharmacies, I think, are now confused. Like, how do they confirm people with pre-existing conditions? Some people have said, like you, right now they just can't get it. Others have said that the pharmacies are going to require a doctor's prescription rather than, I remember just going into my local pharmacy, signing up online and going and getting my shot a few days later. Right. That will be in jeopardy. So many people already don't have insurance in this country and maybe don't have access to their primary care doctor to get in to get a prescription. It's just creating a huge barrier. And this falls right at the feet of Bob Kennedy, as we call him. He's responsible.
And my understanding is that, I have Medicare, so I believe that because I'm over 65, I'm covered, price-wise, in terms of paying for it. But this is a $249 shot. And for somebody who's under 65, they're going to have to pay for it out of pocket now because it's no longer whatever the technical term is?
Yeah, we don't know, right? The CDC, the ACEP, that committee that he fired everyone and then brought new people on, many of whom are anti-COVID, anti-vax, anti-mRNA vaccine platform. Those people still have to weigh in. This is the committee hearing that a lot of it was what swirled around Monarez being fired, the head of the CDC. Senator Cassidy has said he doesn't think this group should meet because he's seen the agenda and he thinks it looks very political and not very scientific. So we have to kind of wait and see. Typically, insurers have followed the recommendations of the CDC and this council in particular. And so it's still a big unknown, but it leaves a big black hole of question of who's going to get covered. I would suspect, the FDA has now said they don't approve it for all these folks. I can't imagine the CDC committee coming in and recommending to people that it isn't officially approved for. Yeah. So, I think there may be this additional barrier rather than just a barrier of being able to get it. people have expenses. They have to pay for car repairs and food and mortgage and rent.
Right.
$249 addition is not going to fit into so many budgets.
Right, and down in Florida, we've got this crackpot Surgeon General, Lepato, I think is his name, or Lepato, or something like that.
Yeah.
And they have ended all vaccine mandates in Florida. Does that mean that parents of children in Florida who want to get their children vaccinated are going to have to start paying for it? Their insurance companies won't cover it?
Yeah, we don't know. I mean, if we have to have a history as our guide with insurance companies, certainly their desire to extract every bit of profit out of people paying premiums is seems to be their guiding principle. I know at the Committee to Protect Healthcare, we've been fighting against insurance company practices since our inception back in 2019, because that extraction of profit is such a huge part of why healthcare in this country is so expensive. And so, yeah, we'll have to see how this plays out. I would still imagine if the CDC is recommending it, irrespective of what the state is saying, that insurance would still pay for it. But again, I mean, you can't, to trust an insurance company to do what's right outside of their
Always
profit-driven
dangerous.
models. The challenge, yeah.
Yeah, always dangerous. So tell me about the Committee to Protect Healthcare that you are the executive director of. I was unfamiliar with this before you came on the program.
Yeah, so we're a family of organizations. Myself and my chief of staff, Miles Baker, started. He comes from a labor organizing background. I've been in emergency position for 23, 24 years in my area in West Michigan, and really came together looking across the landscape and realized really there wasn't a organized voice of physicians advocating on behalf of their patients and advocating in ways that we haven't seen doctors advocate before. We're organized as a 501c3, 501c4 with a affiliated PAC. Like, we have the ability to go and talk about electoral issues, right? We are realizing in this moment who wins elections has such an impact on how our healthcare, not just insurance and not just, the federal programs of healthcare, but public health specifically with the CDC and with the FDA and CMS, how that is administered. And so we believe we should all be fighting for people who are going to go in there and pass policies and support programs and agencies that are working in the best interest of our patients. And really, that's what we're doing with 36,000 doctors around the country, and elevating the voices of those folks, like me, who want to be out and talking about reality-based science and what
Sure.
really helps our patients.
What's your website?
Committee2protect.org.
Committee2protect.org. Okay, I'll
Yeah.
check that out. Thank you. I had a flight attendant call in from Chicago in the last hour, and he said that he's seen an explosion. I'm not sure he used that word, but an increase, a radical increase in what looked like COVID. I mean, he's not running around with swabs to stick up people's noses, but you see it enough, you pretty much know when somebody's got COVID or something at least that bad. What is going on right now? I understand that over at the top of Drudge, it's like California, mask up. Is there a new variant? Is there, or is this just a seasonal reoccurrence, or is this that? I understand that only about 15% of people are actually maintaining their COVID vaccines. Is it that our herd immunity is fading away? Our vaccine-based herd immunity. What's going on?
Yeah, I don't know. We don't have any information on variants, but certainly the seasonal variability is going to be a piece, and is and will be probably forever. And the fact that we have waning immunity and lower uptake of the vaccine by a lot of people. And, this is partly what RFK and his minions say is why they're reshaping the CDC, because the people have lost trust. But the problem is it's him and people like him spreading the disinformation that has eroded that trust. And so, it's definitely concerning. And I think it's even more concerning as the weather turns colder, people kind of start huddling inside. And now there's a big question mark about who can get the vaccine and how much it's going to cost and how hard it's going to be to get. I mean, I lived through it in the ER, and even in a small rural ER, we had waves of COVID that filled up hospitals around our entire region, and we couldn't move anyone. We had people sitting on ventilators, sitting on high flow oxygen in the ER for days, waiting to go somewhere. That reality, unfortunately may present itself again soon.
I've seen, and I don't know if this is, wellness influence or BS, or if this is legitimate, but I've seen this in multiple venues. This argument that viruses over time most viruses, not all. Obviously, rabies hasn't done this, but viruses that have high mutation rates like COVID over time tend to mutate to become less and less deadly as basically a virus survival mechanism, that it can, transmit itself to more people. And that, in fact, the 4 common cold viruses that are generally around are all coronaviruses, that there's a theory that all of them basically started out like COVID, just deadly, and they all over time mutated to become just annoyances. Is that what's going on right now with COVID?
Well, I mean, that may be a theory. I haven't specifically heard that theory before. There's no fact basis of that, right?
Mm-hmm.
COVID is a deadly virus, particularly for certain populations. It's more deadly and others less deadly. But there's often a long period in which you are contagious and you can infect other people before it turns deadly. It isn't something that you catch it and in 24 hours you die. I mean, it's not Ebola. Ebola at very, very rapid onset and very high lethality. But it's certainly high enough and shown to be higher than flu in general. But again, if you have that 3 to 5 days, 7 days period of time where you can just be out and about and spreading it around to whomever, that's the concern. I mean, it can be just as deadly. So I think that may be some wish casting and sort of, kind of retro-engineered justification of arguing against measures to limit the spread.
That was
and
my
vaccines.
fear. That was my concern.
Yeah.
Rob,
and also, a lot of these folks are connected to online platforms where you can see a doctor and get prescriptions for ivermectin and hydroxychloroquine, and they link you to an online pharmacy. So there's always a bit of grift and profit in a lot of the wellness space. Unfortunately, the Surgeon General nominee has made money off of wearables, advising people without diabetes to check their blood sugar.
Yeah. Well, I'm out of time here. It was a hard break.
Okay.
Dr. Rob Davidson at pagingamerica.substack.com. Thank you, Rob. We really appreciate it.
Thanks, Thom.
Yeah.